The Huldeby and Morsell Rothschild Foundation is the only foundation in the country that's exclusively focused on changing the way we care for elders in long-term care communities. We like to say that we're working down our bucket list of what people whine about in the long-term care industry. And so the first issue that we heard a lot about was kitchens, that they wanted congregate kitchens where people could gather around the counter and help prepare food and do the things that they were used to when they were in their own homes. And the Life Safety Code didn't allow them to do that in long-term care communities. And then people said, well, there's some dining issues, so we created some dining clinical standards. And we began to work down this list of what people were complaining about. We got to bathrooms. The ADA traditional bathrooms didn't accommodate elders who needed assistance transferring from their wheelchairs as well as they could. And lighting, there really weren't clear lighting guidelines for low vision populations in long-term care. Well, the next item on the list was noise, whether it was noise from a mechanical HVAC system or squeaky housekeeping carts going up and down the hall, overhead paging systems, the noise from the TV next door, all of those kinds of things, research told us, created residents who were stressed out, they were angry, they would act out, and they were confused. So we recognized this was an opportunity to bring together the best and brightest from the acoustic research community and all of the other knowledge communities who were involved in long-term care around a common table and figure out how we could best advise the long-term care community around issues relating to acoustics.
From my standpoint as a clinician, I see individuals all day long who have very great difficulty communicating in difficult listening environments. So as the acoustics are degraded in a room, their ability to interact with their family and their friends, with their caregivers, is dramatically impacted by that. I was asked to participate in this session because I am very interested in how individuals change with age in their ability to understand speech in backgrounds of noise.
Our regulations don't quite go as far as they should, I think, in this area. But then again, it takes informed research to base requirements on. And I think that's what the guidelines is engaging in now. We got some numbers in the book as hard requirements in healthcare facilities for patient room to patient room arrangements or patient rooms to quarters. Now we're looking at that a little bit more in detail in a skilled nursing environment in particular.
The acoustical design of the facility is extremely important, we're finding now, even for their health, not just welfare, quality of life. Miscommunications with people who are residents or patients, if it is a nursing home, can result in tragic events. So it's incredibly important for people to be able to hear. People have to be able to hear in order to navigate if they have vision impairments. Again, the acoustic environment is critical, I think, to the health, safety, and welfare of people at all ages.
Acoustics is important. I work in the long-term care market, and I love older people. And I watch what happens when acoustics are poor. So you see someone not being able to socialize, they get isolated, they can't converse, they can't see you to be able to talk to you. I find if I sit across from someone, they can kind of read your lips a little, maybe pay closer attention. But after a while, they start to shut down because they can't have conversation. So allowing people to be able to have conversation, have activity, and socialize is critical to well-being.
So we're very pleased that this now represents our newest and 8th national task force around long-term care regulations.